That was fantastic. And again, for those who don't have this, it's in your packet. And there's a number of recommendations. Just to add on to what Larry mentioned. Engage a broad range of parties. Building and maintaining trust. Statement of mission and goals. Anchor institutions. A designated body with a clearly defined charter. Clear mutual understanding of population health. Community health measures. Policy positions. And standing committees with oversight responsibility. There's so many of these core characteristics to maintain this partnership. So, Nicole, now learning a little bit more about what you've done in Iowa, can you tell us, love to hear your experience and a little bit about, so how did you get to all these 11 great characteristics? And can you help the audience understand the journey of going from ground zero to where you are today, and a little bit about where you are today?
Absolutely. And I'm flashing green. Does that mean anything on my microphone? Is the microphone on?
There you go.
Red.
There we go. Excellent.
Red
Wonderful.
is on.
And red is on. There we go. Thank you. So thanks so much for having us today. It's a pleasure to be with you. My first time attending this particular group, and it's been really a wonderful learning experience. And of course, big thanks to Larry, not only for extending the invitation to the Quad City Health Initiative to join him today, but also to him and his team for conducting this research. Several folks have alluded to the fact that research often is poor in areas that we're most interested in knowing about. And for those of us working at a local level, very often it's not easy for us to identify who our peers are around the country. This research has given us a peer group now that we can look to and share information with, and be able to sort of check our experiences against. And so we really very much value that. So to Sunny's questions, I thought I would give you a little bit of background about the Quad Cities and the Quad City Health Initiative, and touch on some of those core characteristics of successful partnerships that Larry already has alluded to. By show of hands, how many in the room might assume that the Quad Cities has 4 cities? Excellent. Well, you clearly know your math, but it turns out we have 5. We, in fact, are 5 cities on the border of Iowa and Illinois: Davenport and Bettendorf, Iowa, and Moline, East Moline, and Rock Island, Illinois. Some of you might be familiar with the Quad Cities because we're about 3 hours west of Chicago and on I-80, so we're a major interstate route for those who might drive from east to west across the country. But those 5 cities on that river community have a long history of collaboration, and I think that history as our community of collaborating really innate our work for the Quad City Health Initiative. So let me tell you a couple little facts about the Quad Cities that might be of interest. My Convention and Visitors Bureau's colleagues would feel I was remiss if I didn't share a couple things with you. So first of all, we're the home of John Deere. So those of you who have a deer at home, the world headquarters, in fact, are in the Quad Cities. We also have a very large presence from Alcoa and several other manufacturing organizations. We're also the home of the Rock Island Arsenal. So for those of you who are familiar with the work of the U.S. Army, we're home to them as well. We actually have a very interesting geographic bent in that the Mississippi River runs from east to west in our community, not north to south. So if you're looking at a map and you notice a little turn or curve, you found us. That in fact is the Quad Cities. And so you can come to the Quad Cities and watch the sun set over the Mississippi River like nowhere else. Our community has about 317,000 individuals that call it home. And as I mentioned, we are near Chicago, but we also are only a couple of hours further away from St. Louis and from Minneapolis. And so really in terms of a Midwest region, we do think very big in terms of our impact and our influence on health. The Quad City Health Initiative itself started in 1999, and it was really inspired by work that was happening around the country in many of your communities, probably, because we really stood on the shoulders of the work that had begun in the late 90s through the Healthy Communities movement and HRET's Community Care Network. I'm sure some of you in the room were involved in that work when it first began. And there were several key individuals in our community who were inspired by that work and felt that we should be doing something in the same ilk. And so a charismatic leader, in our case a physician, an internal medicine doc who was very passionate about improving the health of the community, he started talking with his board colleagues at our 2 local nonprofit health systems, and together they created a community board, and they named themselves the Quad City Health Initiative. And for the first couple of years, the board actually operated as purely a voluntary association of organizations and individuals who are interested in improving the health and quality of life of the Quad Cities area. A couple years after that experience of having formed the board, the 2 nonprofit health systems in our area, one is a standalone health system, Genesis Health System. The other is Unity Point Health Trinity, which is an affiliate of Unity Point Health, formerly Iowa Health System. Those 2 entities decided to become the founding sponsors of the Quad City Health Initiative by putting seed money in to create an office to support the work of the initiative. And that was when I personally entered the scene. I joined the initiative in 2001 as its first staff person. So to touch on a couple of the characteristics of our partnership, the vision for the Quad City Health Initiative is to be our community's leader for collaborative action on health. We want to be the center for our community's work on community health improvement. And the mission of the organization is very straightforward, although lofty. It's to create a healthier community. We have 3, if you will, cultural aspirations, 3 core values, and they are commitment, collaboration, and creativity. The collaboration piece, obviously, I'm sure resonates with all of you since that's today's topic. Creativity we thought was important to include because we recognized that in doing this type of work, we were going to have to try things occasionally that hadn't been tried before, and we wanted to give ourselves permission to seek that work. And the commitment one is very interesting because it's part of, I think, the original ethos for the Quad City Health Initiative, this idea that as a community, we can do whatever it is we put our minds to do. And in fact, the story is that the founding board chair, that doc that I mentioned, his name is Dr. Bud Phyllis, he would actually talk with partners about us just simply deciding as a community that we wanted things to change, and that by making that decision or having that intent, we would start ourselves down this path. My own story about commitment is a little anecdote that I heard to help people understand the difference between being involved and being committed. And it's a farm analogy some of you might have heard, but it says when making bacon and eggs, you have to keep in mind that the chicken is involved, but the pig is committed. And so that always sticks in the back of our minds when we think about what it means to really be committed to a cause. The founding partners that I mentioned, those 2 health systems, continue to provide the majority of the operating support to our work even to this day, 15 years later. And our participation in this study really was a perfect sort of icing on the cake to what was last year, our 15th anniversary year. And so we were really thrilled to be part of the study and thrilled to have it be something to celebrate as part of that 15th anniversary celebration as well. Our current governance structure is a 25-member community board. Some of you might be interested to know that we are not a separately incorporated entity. Our work is actually housed at and through the 2 local founding health systems, and so each of them provide in-kind support and administrative support in various ways to allow us to operate. And we can talk more specifically through your questions about some of the program or issue-based work that we'll do, but I'll just mention that really a foundation for all of that work for us has been joint community needs and community health assessment planning. And that process, which for us has actually been going on since 2002 at a bi-state way, has really sort of set the foundation for all of the collaborative work that we've done together. Our staff is small. Half of us are here today. I have a colleague who's back in the office, but our volunteer network and our associations in the community are really quite strong, and they really are the power of the Quad City Health Initiative. We have roughly 134 people currently working with us in some active way, and they represent about 69 organizations around our community. It really is truly a multi-sector, cross-sector group. Earlier in the day, someone alluded to the collective impact literature, and I just wanted to end with that allusion myself, because as that research came out a couple of years ago, we found it to be incredibly powerful as a way to describe what we thought we had been doing doing, but perhaps hadn't been articulating very well. And so we've actually used a lot of that language about being a backbone and an infrastructure for collaboration to help our current partners and new partners understand what it is we're about and why the Quad City Health Initiative is so important to creating health in our community. So I think I touched on most, if not all, of those core characteristics, and I'll turn it back to Sunny for what's next.